you have to hand it to our hands. They've worked hard for us over the years, so it's no surprise that all that work may wear them down. Dr. Bram Kaufman is here to put his finger on issues that can develop and how to treat them. Dr. Kaufman is a plastic surgeon at MetroHealth. Welcome to the show.
Thank you for having me.
Now, is it inevitable as we age that we're going to have hand problems?
Not inevitable, but it does become very frequent as we age.
Okay.
And the common denominator in all these that we're going to talk about today is inflammation. Inflammation of a joint or a tendon.
Okay, so let's start with the thumbs. Thumbs down, right?
Well, the thumbs are susceptible to overuse, and as we age, we often get arthritis at the base of the thumb. That's called CMC arthritis or basal joint arthritis. Patients will notice weakness, they notice pain at the very base of their thumb near the wrist, and they notice an inability to grip or grasp things. There's a characteristic position of the thumb with arthritis at the basal joint. You can see it on the left with, and that's my hand on the right, without. And you lose the mechanical advantage, so it becomes very difficult to open jars and turn keys with that.
Oh, okay. So what do you do to fix it?
Well, if it's not very symptomatic, then what we do for most arthritis is rest, ice, elevation. We can take anti-inflammatory medications. That often helps.
Okay.
If it's more severe than that and doesn't respond, then sometimes we use a splint. And you can use a splint that's very soft. There's one pictured here that is stabilizes the joint at the base of the thumb. It's movable and it's breathable, so it's comfortable to wear, and it can help with the instability and with the discomfort.
Okay.
If that doesn't work, then we have to resort to surgery. Surgery is designed basically to remove the arthritic joint, which you can see on the before picture on the left. Actually on the right is a normal joint, and you can see the difference in that.
Wow, yeah.
After we remove the joint, sometimes we have to stabilize the joint.
Okay. Next are knuckles. So what's going on when they swell up at the tips here?
Well, one of the most common knuckle swelling we see at the very end of the finger is called a mucus cyst, and it's a joint cyst like many other ganglion cysts. There's a nice picture of one there, and it's filled with joint fluid. Typically they're not painful, but people really don't like the way they look.
Yeah, I wouldn't either. It looks like a blister though, so what do you do for that?
If it doesn't bother you, there's really not much to do. If it does bother you or it's painful, then we can sometimes inject them with steroids. We can drain the cyst, and sometimes we do a little surgery to remove the cyst and clean up the bone that's at the ends of the fingers.
Okay, and then a common one is carpal tunnel syndrome.
Yes, very common, and it does occur as we get older, sometimes in very insidious way, and we don't realize it until it's far, far gone. People will notice pain in the base of their hand, sometimes in the palm. They notice numbness and tingling, like when your foot falls asleep. And this is a picture that demonstrates the carpal tunnel, which is really like a tunnel with three very stout sides, and which are bones, and the roof of the tunnel is made up of a ligament called the transverse carpal ligament. And when there's inflammation in that tunnel, it puts pressure on the nerve goes to sleep, you end up with numbness and tingling. Often you notice it when you're on the phone or using a hairdryer, things like that.
So what do you do?
Well, the simple things to start with are splinting. Usually we splint at night, and if the symptoms get better, then there's not much else to do. Again, a steroid injection in the carpal tunnel can help relieve symptoms. Often that's temporary. And finally, we can do a small surgery that's depicted here where we divide that transverse carpal ligament. That allows the nerve more room to breathe, and it takes the pressure off of it.
Okay, well, it sounds like there is help for hands that hurt. To learn more, use the number and website that's coming up next. And our thanks and a big high five to Dr. Kaufman for this important information and advice.
Thank you for having me.
To learn more, call MetroHealth at 216-778-7800 or log on to www.metrohealth.org. Next,